Mayor John Cooper, followed by Dr. Alex Shahanger, Chair of the Metro Board of Health and the Metro Coronavirus Task Force. Joining us this morning are Dr. James Hildreth, President and CEO of Meharry Medical College, and Lauren England, a third grade teacher at Fall Hamilton Elementary School. Dr. Adrian Battle, Director of Metro Nashville Public Schools, Director Chief William Swan of the Office of Emergency Management and Nashville Fire Department, and Dr. Michael Caldwell from the Metro Public Health Department are here to help answer your questions. We'll now begin with Mayor John Cooper.
Good morning, Nashville. Now, Metro Public Health is reporting continued slow but steady progress in our coordinated COVID-19 response, with 137 daily new cases today. Now that brings Nashville's 14-day new case rolling average down to 147.5. Now this same metric was 181.6 as of 1 week ago and 190.5 2 weeks ago. Now Public Health is reporting 18.4 new cases per 100,000 residents over the past 7 days. Now this is down from 24.2 last Thursday and 28.5 the week before last. This metric peaked at 64.7 cases per 100,000 residents on July the 13th. The red zone for this metric is anything above 10 per 100,000. This is the nation's standard for restricting domestic travel. 10 is also the state of Tennessee's own standard for quarantining facilities. Now, Nashville's 7-day positivity rate has declined to 9.7%, which meets our goal of 10% or less. Our positivity rate was 13% on August the 13th and 10.8% on August the 20th. This metric peaked in Davidson County on July the 9th at 17.1%. Now, we are also at 1,864 current active cases in Davidson County, and this number is below 2,000 for the first time since June the 18th. Our all-time high for this metric was on July the 20th at almost 6,000 active cases. Now, since the surge of the coronavirus cases began earlier this summer, new COVID-19 cases across the United States has begun to level off. The data shows that mask ordinances and other public health restrictions, including a pause in economic reopening plans, are largely responsible for this decline in new cases. Your implementation of social distancing is making a difference. Earlier this spring, though, Nashville's unemployment rate hit 16.1%. Now, for context, our peak unemployment rate in the wake of the subprime mortgage crisis about 10 years ago was 9.8%. Now, since then, unemployment has shown signs of improvement as our economy has slowly reopened. Unemployment here now is down to 12.1% as of the latest available data. But we must do more to support Nashville's working families. We must get people back to work when we can safely do so. Wearing a mask helps get people back to work. Over the past 6 months, we've learned important lessons on reopening our economy while still protecting the health of our community. We are applying what we have learned to help our local businesses safely reopen their doors while protecting the health and safety of their customers and staff. Public health and our business community are working together to accomplish this successfully. Now, Public Health and Metro Legal are drafting adjustments to our modified Phase 2 public health order, which will take effect on Tuesday, September the 1st. Weddings, funerals, and other similar ceremonies at event venues may resume at 1/3 capacity or up to 125 people, assuming proper social distancing. Whichever is fewer. Masks must be worn while standing. These ceremonies must be carefully controlled and supervised and comply with all social distancing guidelines. This will be a safer implementation than people using their backyards or going to other counties without health protocols. Organizers of larger events may submit their plans to the Director of Public Health for review and approval. Transportainment vehicles may resume operation at 50% capacity up to a maximum of 10 people. who must also belong to the same party. Masks will be required while patrons are standing, and this is to avoid contact and spread between any separate social groupings. Limited service restaurants may continue to serve 25 patrons inside, but may expand service to an additional 25 patrons in outdoor spaces, such as patios and rooftop arenas, for a total of 50 patrons per establishment, if applicable. Additionally, restaurants and bars may resume seated-only service at bar counters throughout Davidson County with social distancing between parties to prevent spread between social groupings. Now, as we continue to reopen our local economy, diagnostic testing remains an important part of COVID-19 response. As I mentioned last week, there are no lines at Metro's 3 community assessment centers, and test results are being returned within 48 hours. Businesses should use this free resource as part of their safety routines in keeping their staff and customers safe. We must remain vigilant. The virus continues to pose a threat to all Davidson County residents, including our students, educators, and their families. Within 3 weeks of the start of the new school year, nearly 100 school districts in Tennessee reported COVID-19 infections, some within just 2 or 3 days of welcoming students back to the classroom. As reported earlier this week, 9 schools in Tennessee have currently closed their doors due to COVID-19 outbreaks, 5 in the Middle Tennessee area. The American Academy of Pediatrics reports that Tennessee currently leads the nation in percentage of COVID cases among children under the age of 18. Nashville's classrooms, athletic fields, courts, and gymnasiums should not be laboratories for risk in public health decisions. These are places where our children and their families must know they are safe. And our dedicated MMPS educators and staff also deserve a safe and secure workplace. Now, this morning, it's my pleasure to welcome Lauren England, a 3rd grade teacher at Fall Hamilton Elementary School, who is here to tell us about the virtual learning experience that is protecting MMPS students, teachers, and support staff. Lauren was the MMPS Elementary Teacher of the Year for the 2019 to 2020 school year and is a finalist for Tennessee Teacher of the Year. She has 13 years of teaching experience and 9 years with Metro Nashville Public Schools. I am grateful to Lauren and all of our MMPS teachers for their commitment to Nashville students during these uncertain times. I'd also like to welcome back Dr. James Hildreth, President and CEO of Meharry Medical College, whose timely and insightful commentary has become indispensable over these almost past 6 months. Ultimately, COVID-19 requires only one thing to thrive in our community, and that is complacency. Our progress should give us cautious optimism, but that same progress can easily be lost unless everyone in Davidson County maintains healthy habits. Now, as most of you are aware, Hurricane Laura has strengthened to a Category 4 status, and a significant portion of the Gulf Coast is under an imminent and potentially unsurvivable storm surge threat. Nashville knows too well the profound devastation that natural disasters can bring. We have benefited from help from our neighbors in the past, and now we can help them back. As requested by the state of Louisiana, a total of 21 personnel from the Nashville Fire Department and Metro Nashville Police Department and Metro Public Works are headed south with vital equipment to assist with emergency response efforts. And we wish our Metro employees a safe deployment as they assist those in the storm's path. Remember, Nashville, don't share your air. Always wear a mask in public places, maintain social distancing from others, and visit covid19.nashville.gov to learn more about how you can avoid getting and spreading the coronavirus. And I'll turn it over now to Dr. Alex Shahanger, Chair of the Metro Coronavirus Task Force.
Thank you, Mayor Cooper, and good morning, Nashville. Here's an additional data on the coronavirus in Davidson County. This morning, the doubling time for this virus is 117 days, meaning that it will take that long for confirmed cases to double. This is the highest this has been since the beginning of the pandemic. 1 month ago, the doubling rate was only 25 days. This much of an increase in 1 month shows just how much this virus has slowed down its spread in our community. The 7-day positive test rate has also improved. Today's rate of 9.7% is the lowest it has been since May 31st. A positive test rate around 10% or lower shows that there is an adequate amount of testing in the city, and its improvement shows that the virus is slowing its spread. This morning, 129 people are hospitalized at Nashville area hospitals because of COVID-19. A little bit more than a month ago, that number was 222 individuals. In late July, we tested more than 21,000 people in 1 week. Last week, we tested 11,621 people. But remember, back in July, we had more than 5,800 active cases. Today, we have 1,864 cases in the county. That's one explanation for why the number of tests have dropped. As there's less cases in the community, fewer people are exposed to the virus. And so, less people find themselves in situations where they have been exposed, and thus less of a reason to go get a test. Furthermore, decreased hospitalizations, which we are seeing, and a lower test positivity rate, which we are also seeing, indicate that the spread has slowed. Today, we have 23,492 people who have recovered from this virus. That's nearly 92% of all cases. This is the highest this number has ever been. I bring this up to you because some of you may have seen a recent report about someone in Hong Kong who tested positive for the virus for a second time. Now, the good news is this virus didn't affect this person as badly the second time around. In fact, he was asymptomatic, and the only reason that this was picked up was as a part of a normal protocol for anyone that flies into a Hong Kong airport that has to get tested. The bad news is that he was infected with a slightly different strand of this virus. Now, the takeaway from this is the following. If you have had the virus, like 23,000 Nashvillians have, you most likely have antibodies and memory cells that will protect you in your system. However, a slightly different strand of the COVID-19 virus can reinfect you. And while a second infection may not impact you because you have this immunity, you can possibly pass this virus on to someone else. So, if you have recovered from this virus, you still need to take the precautions like wearing a mask, social distancing, and washing your hands. Do this to protect others. A couple of reminders this morning. The community assessment centers are open to 1 p.m. today, and they're open 5 days a week from 7 a.m. to 1 p.m. If you have any concern that you may have COVID-19, or if you think you've come in contact with someone that's had it, please get tested. It's free. The time to get the test is short, and the turnaround time is less than 2 days. And also, please get a flu shot. You hear these reminders starting this time of year. This year, it is very, very important to get this flu shot. If our cases increase and we have an aggressive flu season, then this will put a strain again on our healthcare system and our healthcare workers. So please, please get a flu shot. Now, our key metrics are showing that this virus is slowing its spread in Nashville. However, we can still improve. Progress has been slow, and I know you have all made some pretty significant sacrifices to get us to where we are right now. And for that, I'm grateful to all of you in Nashville. But I do want to leave you with this message. Don't let up. Don't get complacent. Keep pressing forward and doing what you're doing. I'm very grateful, and I now would like to introduce Dr. Hildreth.
Good morning, Nashville. Today, I'd like to share some more recent research results that I think will help us understand why COVID-19 and the virus that causes COVID-19 causes such extreme damage to the lungs. Our body consists of a combination of complex and elegant systems with billions of cells that make up these systems. And they're all coordinated, for the most part, by the exchange of chemical signals. The immune system works in the very same way. For example, when we want to lift our hands or move our feet, chemical signals leave nerves in our brain, make their way to the appropriate muscle cells, and we exercise or make that motion that we've intended to make. So it turns out that in the immune system, small signals are sent and received by our cells to allow the immune system to function the way it does. And as I shared with you earlier, viruses cause diseases in two ways. Viruses can directly destroy cells in our organs and tissues, but also the immune system, when it responds to viruses, can cause damage to our systems as well, especially when the immune response is vigorous and quite robust. There's a family of proteins on our immune cells called toll-like receptors. We call them TLRs for short. One of these, TLR4, is particularly good at causing inflammation. And when the right chemical signal binds to TLR4, it then sets off this huge inflammatory response that recruits other cells, causes chemicals to be released. It's a potent inducer of inflammation. Researchers in multiple laboratories have now shown that the spike protein of the COVID-19 virus actually can mimic the receptor or the ligand for TLR4 and trigger the exact same inflammation. In other words, the virus is pretending to be the chemical signal that causes TLR4 to do what it does. In biology, we call this molecular mimicry. What this means is that when the COVID-19 virus is replicating in our lungs, it's actually setting off the signals that cause inflammation in the exact same way the chemical signal would. And this is probably why the virus is able to induce such strong inflammation in our system. It also means that we now have another way possibly to treat this disease. And even as I speak, there are clinical trials underway that are evaluating whether drugs that block TLR4 will be useful as treatments for COVID-19. And some of those studies have advanced to the stage 3 clinical trial. So this is very exciting. As you've heard from the mayor and from Dr. Shahanger, we've actually done a good job, Nashville, of turning the tide here. But I want to remind you what happened in late spring when we had good numbers, good metrics, and Memorial Day came along, and Independence Day came along, and we got complacent, and before you know it, the mayor was announcing we had to take some steps backwards. So please, Nashville, let's keep it going. The numbers are great. I'm really excited about the fact that the percent positive is now below 10%. And the rate per 100,000 is now close to 10, where we want it to be. And if we just keep it going, we're gonna be able to reopen the economy, feel good about having our kids back in classrooms, and we have the power to do that. We just gotta keep it going. Because once again, you've done a great job. We need to keep that movement going. So with that, please get a flu shot. As you've heard, if there is an aggressive, challenging flu season on top of COVID-19, it's gonna put a tremendous strain on our healthcare system. Not to mention the fact that people could possibly get both viruses, and the morbidity and mortality associated with that could be quite profound. So Nashville, let's get the flu shot by all means, especially if you're over 60 years of age. There's a especially strong flu vaccine that's been designed specifically for us, because I'm in that category. That's the one that I'm gonna get. So Nashville, we got this. We've always had it. Let's just keep it going. With that, I'd like to introduce Lauren England from Metro Nashville Public Schools.
Thank you, Mayor Cooper, for this opportunity to speak today. When I walk into my third grade classroom at Fall Hamilton Elementary, I wish I didn't have to spend the day there by myself. I miss seeing my students in person. But the most important thing is that my students are safe, and they wouldn't be coming into our buildings each day while COVID-19 is still spreading in Nashville. So the virtual learning environment continues to be the best option for our students and their health. And the exciting thing about the virtual learning environment is that we can still build our classroom communities each day. My students still give appreciations for one another at the end of the day, and we recite our class mission statement. Students have an opportunity to share how they feel and what they're excited about learning. The physical separation over the past few weeks hasn't stopped us from doing what we need to do. We're getting to know each other. We're forming strong relationships, and we are teaching and learning. My students are still learning their multiplication facts and how to find the central message of a story, both through our synchronous lessons on Microsoft Teams and on the Schoology platform. I give so much credit to my students, to their parents, and to my fellow teachers for this. Every staff member and teacher at Fall Hamilton Elementary are connecting with students and families to make sure that they are supported in the virtual learning space. We're talking to them about technology issues, good learning habits, and anything else that they need to be successful academically. And I know this is happening all over the city at the rest of our schools too. It's a challenging time for everyone, but I'm grateful for Dr. Battle and the Board of Education to ensure our students' health and safety, while also ensuring that our students will continue to learn and grow. Thank you.
Thank you, Ms. England. We'll now begin taking media questions, starting with Brett Kelman at the Tennessean. Brett.
Good morning, everyone. I have a question for the mayor and Dr. Shahanger and Dr. Hildreth. As I'm sure you guys have seen, the CDC has revised its testing guidelines to say that it is no longer necessary for everyone who was exposed to coronavirus to be tested. I'm curious what the doctor's opinions on this decision is, and if the city will be changing anything about the way it operates its testing facilities as a result of this. Will Nashville continue to encourage everyone who is potentially being exposed to coronavirus to get tested at your facility?
Thank you, Brett. Dr. Hildreth.
Brett, I have no way of knowing why the CDC made that recommendation, but I can tell you the science would run contrary to that. For those of you who would like to do so, go to the National Library's search engine called PubMed and type in COVID-19 asymptomatic, and you will see for yourself that this decision was clearly not grounded in science. Asymptomatic and pre-symptomatic transmission of COVID-19 is still a serious driver of transmission in communities. So my recommendation to the mayor is that he not change the city's policy regarding this. So PubMed, type in asymptomatic COVID-19, and you'll see for yourself that the science runs contrary to what the CDC has said. So, thank you.
And to follow up on that, the city is not changing its policy on testing. Anyone that feels like they need a test is happy. We're happy to see you at any of our community assessment centers from 7 a.m. to 1 p.m. Monday through Friday. Thank you.
And thank you, Brett. Since you asked for my view, you can see how proud I am of our health team, and we're going to follow professional scientific advice here in Nashville and not wishful thinking.
Nancy Amons at WSMV, you're on the air.
Hi, thank you very much for taking questions again. I'd like to hear your thoughts on, with metros and metrics now looking so good, do you have a date or an idea in mind about moving back to phase 3? I have a COVID unrelated question for the mayor. His opinion on the push to have a referendum now on holding a tax increase, the property tax increase to 2%. Petitions were turned in yesterday on that.
Thanks, Nancy. Start with your first question. We'll go ahead with Mayor Cooper.
Well, thank you, Nancy, and I'd welcome the doctor's opinion on your first question also. We are making progress, slow but steady progress. I guess I don't think you can quite say looking so good. You know, we're looking better, but we're still basically twice what Tennessee's own standard is for quarantining facilities. We still cannot travel freely in the United States. We're better, but we have to make steady progress. And then on your question on the referendum, I'm sure this will be the signatures, I believe, filed yesterday. This will be actively discussed in the community. And it needs to be for another time and venue. Ultimately, I do worry that the result of this is just forcing a stealth election on Nashville, a very expensive stealth election on Nashville, in order to give the city a poison pill. And it's not about just about the property taxes. It's has all kinds of stuff on it that is frankly a poison pill for our city. And everyone who serves the city, every teacher, every police officer, every citizen of the city would need to be deeply concerned that this is a poison pill. And we want to create a great city going forward in the 21st century and not create a backorder here and have us swallow unintentionally a poison pill, particularly through a stealth election. Thank you.
So, Nancy, thank you. Your question about, I guess, the semantics of calling it a phase 3, phase 2. Data and science have been driving this. And I think I just want to highlight that we are very carefully turning the dial back to where more things can happen, right? So wedding and such events up to a third of capacity, no more than 125. There can be 25 additional people sitting outside in a restaurant. The bar area of a restaurant will open up. These are all very small incremental increases in what we've been able to do, and we'll dial it up. And if everything seems to be working well and these numbers continue to head the right way, there'll be another further dial up. So I understand the reason that people need to anchor on is it called a phase 2 or phase 3, but look at what we're doing. And I think more and more is being done. And I don't think there's a timeline per se, rather than as it makes sense, we'll do our best to open up our communities in a safe manner. Thank you.
Ian Jung at the Tennessean.
Hi, good morning. Venues are allowed to reopen starting September 1st at a third capacity or 125 people. Can you kind of give some details about what you mean by allowing similar ceremonies? What sort of rules would be in place to prevent, say, house parties or parties hosted at venues? And then with transportation, would that be with alcohol or without alcohol? Can you kind of give some details about that as well? Thank you.
Thanks. Dr. Shahanger.
So, frankly, though, we're defining what that means. So weddings, bar mitzvahs, funerals, those are the types of events we're talking about. We're not talking about house parties. So there's the legal definitions are being worked out, and that will come more. So regarding transportation, capacity is going to be 50% capacity, whatever the vehicle could carry, no more than 10 people. If you're standing up, you have to put a mask on, just like you have to do in our restaurants. So stand up, mask up. I think alcohol will probably be allowed if you're sitting down, but our very extensive team of lawyers and policy experts are finding those details. But that's kind of what I can share with you at this moment. So thank you.
Kathleen Suri at Fox 17, you're on the air.
Good morning. Thank you for taking our questions. This question is for Mayor Cooper. So we know that Metro Council recently shot down a move to end lifetime benefits for representatives who have served terms. They're holding a press conference today. So as the city continues to overcome financial struggles and impose the 32% property tax increase, does the mayor think it's fair for council members to continue receiving this benefit? Thank you.
Thank you, Kathleen. Mayor Cooper.
Thank you, Kathleen. I'm not aware of the press conference. I'll be looking in on it to see what Metro Council's opinion is. It is always complicated to remove a benefit for any public participating employee, including council people, but obviously the city needs to carefully calculate any additional cost and benefits that we give to anybody, and I'll depend on the council to start that process. I'm assuming that's what this press conference is about today.
Our last question today is from Harriet Wallace at Fox 17.
Yes, good morning. I do believe you said Dr. Battle was in the room. So my question is regarding the future of high school sports, particularly football. A number of coaches have expressed some great concern about this. I want to know first your thoughts about their disappointment and the disappointment of some of the players, as some of their college futures depend on them playing this season. Also, what does this mean for their jobs, those who are employed as coaches, but now there's no season, or we don't know yet. But then that leads to my next question. Any idea when you all plan to revisit the season and look at maybe reinstating it? Thank you.
Thank you, Harriet. Dr. Battle.
Thank you. As we've been communicating with regards to our phased-in approach to reopening metro schools, we will continue to make our decisions really grounded in safety for our students. As a former student athlete, I understand the importance of all of these experiences, both in the classroom and in this particular case, on the field for our students, for their benefits now and for the future. And so we are continuing to engage in dialogue with our coaches, providing them frequent information as we receive it. We try to get that information out to our coaches to best inform our next steps for all of our student athletes. And again, we want to make sure that safety is first. We also want to recognize that they're student athletes. So we want to make sure their academic opportunities are strong, that they're connecting and engaging with their teachers. But we also want to ensure, if at all possible, that they get these extracurricular activities as they've been working towards and planning for. With regards to the status of our coaches and any sponsors that are out there, because remember, we being a large school district, we have many fall sports that would be taking place right now. We also have many extracurricular activities, performances, and other specialized clubs. We continue to support our coaches and our sponsors. Our coaches and sponsors who are also educators and teachers in the classroom continue to work with our students. And based upon our latest communications, we are allowing for conditioning and non-contact activities to continue to make sure our students continue to progress. Right now, we are in a pause phase with regards to contact and competitions to ensure we're keeping our students safe and we're doing our part to help our city continue to make significant progress. Thank you.
Thank you, Harriet. If I could just have a word after Dr. Battle's response, it's understandable. But if you're upset about delays in our season, be upset with people who are not social distancing. The disease level is our county's report card on how we're doing in public health. Right now, we do not have a passing grade. So apply that upsetness to getting a higher level of social distancing and mask wearing and care taking place. This is the job at hand. This is what will put students back in classrooms and players on fields sooner. It is unfair to ask this group to take an extra risk when we as a county have had, frankly, a bit of a failing grade on how we have been performing all of our social distancing measures. Every bit of data shows that it works, but it works slowly. And to backslide at this point on this could have an even more devastating effect. But when people are upset, look to themselves, look to each other. We can work together on this. We have to work together on this to do this. And an element of dividing the community is simply not useful as opposed to supporting each other to be able to resume back to our normal life. All that we are doing and persisting to do here is when we learn how we can make an adjustment that can safely add economic capacity and put people back to work, then it's our obligation to do it if we feel that we can do it safely. And in the transportation case, which came up earlier, frankly, public health, if people were in one social group, less than 10, doing social distancing, it's only fair that they be allowed to open. They're not Nashville's favorite group, frankly, but fairness requires this protocol change to take place. This is the kind of adjustment that we should be expected to make out of basic fairness. And then MMPS teachers and staff and the board members and everybody need to expect the same level of fairness when they make very tough decisions too. We are at twice the disease level that the state of Tennessee says that quarantine should be happening. So that's a very hard environment for us to reopen ourselves when the state is also indicating that that's 2x of the disease level, and certainly the federal guidance has been consistent with that also.
Those are all the questions we have this morning. I'd like to thank Dr. James Hildreth, Ms. Lauren England, and Dr. Adrian Battle for joining us this morning. The next Metro COVID-19 press briefing will air on Thursday, September 3rd at 9:30 a.m. Thank you for joining us. This concludes today's event.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.org.